All right. So we are recording live on Facebook. We are here today for the press conference for the Plum injection well. And I want to, first of all, thank everyone for coming to the press conference this morning. We're going to go ahead and get started. My name is Gillian Graber, Executive Director of Protect PT. I'll be your MC for this morning's event. Thank you everyone for attending. And so the way we're going to do this is we have some speakers planned, and we're going to go through our speakers, and then there'll be an opportunity for press to ask questions. And we are recording live on Facebook. So if everyone could please mute themselves, as well as if you don't want to be on camera, go ahead and turn your video off. So today we're here to announce Protect PT's support of the Plum Borough and its appeal to the second gas waste injection well in Plum Borough, Allegheny County, Pennsylvania. Today we're going to be hearing from concerned residents and medical professional about some of the issues associated with the injection well and health and environmental concerns associated with oil and gas waste. Since the beginning of its operation in 2021, PENNECO Energy Solutions has received DEP violations for failing to report complaints of suspected water contamination. Plum Borough has also received multiple resident complaints for constant truck traffic, noise, and loss of enjoyment of their property. In late February, Plum Borough appealed its own zoning hearing board in this unique case after the Plum Zoning Hearing Board approved the expansion of the Sadat 4A oil and gas waste injection site to include a second injection well. Protect PT supports Plum in their effort and has noticed Plum and PENNECO of our intention to intervene in the case, further supporting Plum Borough. In its appeal, Plum Borough states, the borough has appealed the decision of the Zoning Hearing Board because PENNECO failed to show its proposed expansion will not be a detrimental harm to health, safety, and welfare of the people of the neighborhood and the community of Plum Borough as required by the zoning ordinance. In the vote for expansion, Plum Zoning Hearing Board members repeatedly stated that they did not want to approve the expansion, but felt that they had to approve it because the last time the borough turned down PENNECO, they were taken to court. You can actually view those statements on our YouTube channel at Protect PT on YouTube. I would like for anyone watching today or in the future to understand that municipalities need to start standing up for the people that they serve. When municipal officials and board members take an oath of office, they take an oath to uphold the municipal laws and our Pennsylvania Constitution and do what is in the best interest of the community and for the people they serve, not simply take actions to avoid litigation from the oil and gas industry. The people of Pennsylvania have the right to clean air and pure water as defined by our Constitution in Article 1, Section 27. We commend Plum Borough for standing up for the rights of its citizens and want other municipalities to know that they too have the power to say no and should do so because citizens have the right to clean air and pure water, and we also have the right to sue. So we are first going to talk to Katie Sheehan. She is a Plum resident who has been impacted by the current injection well. So go ahead, Katie.
Hi everyone, my name's Katie Sheehan. I live at 1835 Old Leechburg Road. I'm right below the Sadat 3A injection well. Today I wanted to tell you what it's like to live near this injection well. I would never have imagined having to deal with all these new daily nuisances and concerns when my husband and I decided to move into my grandmother's home. I always remember how quiet it was sitting outside with my grandma under the apple tree on a summer day, overlooking the pasture and hillside, enjoying an ice cold glass of well water. Now you hear trucks every hour. To yourself, there goes another load of carcinogenic material to be dumped, and I wouldn't dare drink our well water. It has been tested to show higher than recommended levels of several elements and a higher pH. Truck traffic is essentially 24/7. There is one truck on average every 40 minutes or less between 5 a.m. and 2 p.m. And I was able to shoot a live video on January 7th showing 5 trucks going to and from the injection well site in less than an hour. Some trucks are even tailgating one another coming to and from the sites. Traffic picks back up around 9 p.m. and does not stop all night long. I am concerned about the truck emissions, noise level, and concerns for speeding, and most of all, the concern for what they are carrying. I have both cameras and noise monitoring devices on my property to monitor the truck traffic activity 24/7. I am concerned for my family's health. We will always be concerned about the probability that our water may be contaminated. I have filed complaints with the DEP, EPA regarding the changes to taste, odor, and coloration to mine and my family's water source since the first site went active. I have filed several complaints with the DEP and Allegheny Health Department regarding concern for a chemical odor in the air. On days that the odor is strong, it does cause headaches. I have an air quality monitoring device on my property that records data 24/7 and has shown volatile organic compound spikes. When I learned that PENNECO wanted to put a second injection well at the same site, I was devastated. We have attended the EPA public meetings prior to the approval of the first site and have attended multiple Plum Council and the zoning board meetings to express our concerns in opposition to these sites. The risk of toxic chemical and radioactive contamination of drinking water, mine subsidence, and the potential for earthquakes and road degradation from hundreds of trucks are all the reasons that my opposition to the current and second injection well sites.
Thank you very much, Katie. The next we have Laura Dagley. She is a resident nurse and the medical advocacy coordinator for Physicians for Social Responsibility. Go ahead, Laura.
Hi, thanks, Gillian. So like Gillian said, my name is Laura, and my focus at Physicians for Social Responsibility has been on reviewing literature and educating others on the health impacts from the oil and gas industry. Residents are concerned about the potential health impacts of the injection well, and they have every reason to be. In January, I testified at the zoning board meeting about some of the health risks associated with injection wells. In 2016, the EPA published a study identifying over 1,600 chemicals that are used in fracking fluid or are found in fracking wastewater. And some of these contaminants are injected into the wells, things such as methanol, petroleum distillates, ethylene glycol being some of the most commonly found. And some of these things are just naturally occurring, such as radium, but they are brought to the surface with the wastewater, and radium is radioactive. So some chemicals are things that you may have heard of, such as benzene. They are known as volatile organic compounds, or VOCs, and they are also known carcinogens, meaning that they cause cancer. And the chemicals found in fracking wastewater, they do range in classification from just being mild irritants to having acute toxicity in humans. And there are several ways that people can be exposed to these chemicals. Some of them can become airborne by volatilizing or essentially evaporating when the waste fluid is exposed to air. Once they are airborne, then people can be exposed by breathing them in. And exposure to these contaminants through known air emissions from oil and gas operations have been proven to have short-term and long-term health impacts, even at low levels of exposure. Upper respiratory symptoms, things such as eye, nose, and throat irritation can be felt immediately upon exposure to these chemicals. Impacts to breathing, things such as triggering asthma attacks and bronchitis, headaches, nausea, skin irritation can be felt within hours of exposure. And longer term exposure, months to years, can lead to worsening of chronic symptoms, such as heart failure or COPD, and can even lead to the development of these chronic issues, and also lead to things such as cancer and leukemia. Another route of exposure is if these compounds get into the groundwater through something such as a well casing leak, and people were to drink this. And the EPA has found that health effects associated with chronic oral exposure to these chemicals include things such as neurotoxicity, immune system impacts, liver and kidney toxicity, and reproductive and developmental toxicity. And it can also lead to the formation of tumors, according to the EPA. And aside from the fracking wastewater, an injection well brings an increase of truck traffic, as Katie said. She'd noticed herself. And aside from just the physical nuisance of it and the noise, truck exhaust is another known and well-documented form of air pollution. It contains many of the same compounds that we were talking about with other air pollution sources, things such as VOCs or particulate matter. And exposure to it can have the same health effects, ranging from the irritation of the eyes and nose to headaches and nausea to, again, respiratory disease and lung cancer. Truck exhaust also contains polyaromatic hydrocarbons, and these have a low degree of acute toxicity, meaning just a small amount of exposure to these can be toxic in humans. Some studies show that they cause cancer and other health impacts to the lung, GI, and renal systems. And I often struggle with how to present all this information on health impacts from fracking operations, because I know it's a lot of heavy information, it's a lot of science to unpack and scary sounding consequences. And because I also know a lot of the people listening to this information are people whose health is potentially at risk from these sites. And so I guess what I hope to say is that what I hope is taken away from what I said is that the concerns of the local residents are valid, and there is science and research to back up their concerns. And so that I hope the people making the decisions that impact Plum Borough are making the decisions that prioritize the public health and safety of their residents. Thank you.
Thank you very much, Laura. And Laura also testified at the hearing for Plum Borough, and we're going to have all of the comments available at the end with a press release for folks. So next we have Matt Kelso. He is the manager of data and technology at Frac Tracker Alliance, and he's also a Plum resident. Go ahead, Matt.
Thank you, Gillian. I wanted to talk today about the role that regulators play in this situation, including the U.S. Environmental Protection Agency and the Pennsylvania Department of Environmental Protection. I actually have a small amount of sympathy for these agencies because they were given an impossible task. If you go and look at their mission statements on their websites, they are supposed to make sure that industry does not adversely affect people and the environment. But at least with this issue, they are unable to do so. They know that disposal wells can cause earthquakes. They know that they contaminate groundwater. We know that this well in particular had a failed mechanical integrity test in June of 2021, for example, which corresponds with the water supply complaint that Katie talked about. The waste company was required to put an additional pipe in the well bore, although regulators at EPA were bending over backwards to not call it a casing failure when we had a call with them. They also denied 2 separate Freedom of Information Act requests about the situation. Regulators know that tank batteries on site release volatile organic compounds to the atmosphere. They know that the constant stream of diesel trucks that bring the waste fluids to the site have a negative effect on health as well. They know all of this. So why do they allow for these wells anyway? You'd have to ask them to be sure, but they also know that the oil and gas industry generates billions of gallons of toxic waste fluid each year. Nobody has yet invented a safe method for dealing with this waste. These disposal wells are considered to be the least bad option, not the best option, but the least bad. The short of it is that if they do what it takes to truly protect people from disposal wells, the whole industry will grind to a halt. There must be enormous pressure on these agencies because it very much looks like they have forsaken their missions of protecting people and the environment to facilitate the enormous needs of industry. Clearly, these agencies are willing to tolerate some amount of impact, some amount of suffering. Some people in offices in Harrisburg or Philadelphia might rationalize this as an acceptable sacrifice. And we're here to tell you, though, that the people who live in harm's way do not.
Thank you, Matt. And so we're going to go ahead and open it up to questions. So if you have questions for Katie, Laura, or Matt, please, you can unmute yourself and ask a question. And I would say just we'll try to get questions one by one and make sure everyone has an opportunity to ask. You can also put your questions in the chat as well, if you'd like to. Right. And while we're waiting for folks to ask questions, I want to share my screen. I actually have up with me. Katie had mentioned there's a VOC monitor near her home. We have placed a VOC monitor, and we've been collecting VOC data on the truck traffic as well as the venting that has been occurring. Multiple residents have complained of odors using our mobile app, as well as using tools that the borough has set aside in order for folks to talk about these issues. I'm going to go ahead and put this on the screen so folks can see what we're talking about with VOCs. Can everybody see that? Okay. Yeah. Okay. So this is what we're talking about with volatile organic compounds. You can see the spikes get quite high. I have over the course of the last 3 months. And I'm not sure folks online can see that on Facebook, but we're happy to provide a screenshot for you if you can't. All right, so I'm going to go ahead and stop sharing my screen, and then if folks would like have some questions, please put them in the chat now. All right. This will also be available on Facebook Live, and we'll post it on YouTube as well.
Hi, can you hear me?
Yes,
I apologize. I've raised my hand, but I wasn't sure what the process was.
So sorry, I can't see that. Go ahead.
Oh, okay. So thank you for taking my question. So where are we in the process of a legal fight for this? I know you guys are saying that you're standing with Plum Borough, but what does that process look like, and where are we in the process to sort of stop this?
So Plum Borough filed their appeal for this site. They had 30 days to file that appeal with us from the zoning hearing board decision. And this is a really unique case because they have basically filed an appeal against their own zoning hearing board, which usually doesn't happen. And then the next step would be for it to be assigned to a judge, which it already has been. We motioned yesterday. Our lawyer went to motions court to ask to be an intervener. We have sent notice. We have to give 10-day notice on that, and Plum Borough, as well as the zoning hearing board, have said that they will not oppose our intervention. Of course, PENNECO probably will. But that the next steps would be for our lawyer to go to court and in front of a judge, and just to finalize that motion for us to intervene. And then there will be a briefing schedule that will most likely be put out, and then they'll schedule oral argument. I'm not sure exactly when that's going to happen, but I will say that a piece of this that's not at the local level is the EPA permit, which PENNECO mentioned in their presentation to the zoning hearing board that that would be coming, I think, any day now. And they have been in talks with EPA about that second permit. So there will be a process for public hearing with the second permit as there was back in 2016 with the first one. We would also request, as we did back in 2017, that the DEP require a public hearing as well. So there may be 2 public hearings for the second injection well for this expansion of this facility.
Thank you. And if I could ask one follow-up, so they haven't procured the permit yet, so we're still early in this process. It's not like there's a design and construction phase that has started. Is that correct?
That's correct. With the expansion, because of the nature of what they're proposing, they already have their tank farm. They already have everything that they would need except to hook up what is a producing well now. So it's a producing conventional well that they're converting to an injection well. Early last year, we actually had a press conference. You can view that on our YouTube about some of the issues. Dr. Ingrafia, he is a professor at Cornell. He could not be here today because he's out of the country. However, in that press conference from last year, he cites all the reasons why that is a really terrible idea. And that goes to Matt's point about why the casing failed. Already we have 1 casing failure. And so some of our main concerns are that any kind of casing failure, any spill or release or leak of fluids could cause health impacts as well as water contamination. And this is very close to the Allegheny River, which is the drinking water system for Pittsburgh.
If I may jump in for a second, I think it's also important to realize that it's really easy for PENNECO to expand this site. So the well went into operation in late February, early March of last year. And by April of last year, they had already emailed a request to double the amount of liquid waste that they're able to pump into that site. And they received that authorization without any input from community or any other stakeholders.
Right. And at the same time, we had written a letter to Governor Wolf. We wrote a letter to the EPA asking them to review Dr. Ingrafia's expert opinion on this. And they actually failed, the EPA failed to get that letter. So we sent it again when we had discussions with them after a right to know request from DEP revealed that there was an EPA there were EPA papers available on the casing failure. Yeah. Right. And so if anyone else has any questions, you could go ahead and put your name in the chat or let me know in the chat. I can't actually see the reactions. So I apologize for that. And Mary just put the copy of the press release, the link for all the speakers and their comments in the chat. And if you registered for today, which everyone here should have registered, then you will also get an email very shortly after today with the press release included. All right, so does anyone else have any questions before we wrap up today? Okay, well again, thank you everyone for joining us this morning for this really important discussion and for us to support Plum Borough and its appeal of the second injection well in Plum Borough. I'm Gillian Graber, Executive Director of Protect PT. Our main points today that we want to get across, number one, residents like Katie have already seen impacts from the first injection well. You know, increasing this site will just cause more harm and misery to folks that live near it. Municipalities should not be afraid of industry and make bad decisions based on fear. They should make decisions based on what's in the best interest of the community. And the well has already failed once, and the only protection from this oil and gas waste, as Laura Dagley pointed out, and the human health concerns, is the casing. This is one of the ways that we protect our water sources. Again, this is very close to the Allegheny River, the public water source for the Pittsburgh region, as well as all other downstream users. And this casing has already failed once, because this is a conventional well that's being converted into a waste injection well. And so we have outlined the public health risks associated with this. And so those are our main points we want everyone to take away today. And we want to thank everyone for coming. I want to ask one more time if anyone has any questions before we hop off today. Katie, okay. Matt, do you want to say anything about the mine that's in Plum Borough that's still on fire near the Allegheny River as well, or?
Right, so this goes through a portion of the Renton mine. The Renton mine is a complex mine. It has multiple different layers, and a portion of that mine has been on fire. I'm not sure. I know they've been trying to get that under control. I don't know if they have yet or not, but it was on fire since at least 1959. So we were talking about decades of burning underground. We're not clear what kind of damage that's caused to the structural integrity of the different geologic strata. So the whole area is undermined. About 90% of Plum Borough and surrounding communities are undermined. So you already have the risk of mine subsidence if there's even a small seismic activity that happens from this well, which is certainly possible. So it's just a risk of the unknown. Like it's incredible that they permitted it in this location.
All right. Thank you, everyone. We're going to hop off today. This recording will